You're welcome to my channel. Thanks for visiting. Please remember to subscribe. If you've been following all my presentations, you'll know that we've been dealing with schistosomiasis for a while. Today is about the very good medication that can kill the adult worms when it comes to schistosomiasis, and that will be Praziquantel, the drug of choice. Without further ado, let's go. For us to understand why Praziquantel is so important, it would be nice if we can go through the full presentation on the treatment of schistosomiasis through this link. Also the life cycle right here and the clinical features here. No doubt, for schistosomiasis treatment, the drug of choice to kill the adult worm has remained the Praziquantel. But Oxamniquine could also be used or combined. I'll address that right here. We can't just give Praziquantel at any time. It must be given at a specific time. So the drug of choice for schistosomiasis is Praziquantel, and it must be given at a certain time. It will only kill the mature worms, and the least time we can give it is between 6 to 12 weeks post-encounter with the secari. Resistance to Praziquantel is not so common. Whoever is receiving Praziquantel, the immunity will play a major role as well. So the drug will be able to effectively wipe off the helminth. I'll talk more about that timing because the first thing to give when we are faced with Katayama syndrome or itching or anything will be corticosteroid. And of course, anything you can use to alleviate the itching, right? But to really kill the adult worms, to end the life cycle completely, we have to use Praziquantel. Okay, when can we give this medication? The age of first use. To many authorities, it should be 4 years and above. But World Health Organization is okay with the use of Praziquantel in anyone that is 1 year and older. So let me put it right, that some will say don't give it in anyone less than 4. The World Health Organization will say give it in anyone 1 year and older. But I will say that discuss with your pharmacist and clinical pharmacologist. When it comes to pregnancy and Praziquantel, Praziquantel is under category B in pregnancy. And what is category B saying? It's saying that they've done animal studies and they've not found any risk associated with fetus through the animal studies. But they don't have enough info to say the same in human fetus. So the risk is not so profound, it's not so established. So when it comes to pregnancy and Praziquantel, the World Health Organization says you can use it in pregnancy, but you weigh the benefits and the danger. But I would say make adequate consultation with your OBGYN and pharmacist. In breastfeeding, the World Organization says you can use it, but you weigh the risk and the disease when you are giving Praziquantel. Or you give the Praziquantel at least 72 hours between breastfeeding and the medication. I will say here contact the pediatrician and your pharmacist. Now, the dosing. Some will say, oh, just give Praziquantel 1 dose, and others will say, no, you need more than that. But let's see. You can give single dose of 40 milligram per kilogram once if you are dealing with Schistosoma hematobium, Mansonae, or intercalatum. But you need higher dose of about 60 milligram per kilogram once if you are dealing with Schistosoma japonicum or Schistosoma mekong. But that should be curative, the single dose. Not in all cases that no, it will be curative. Whether, since immunity against schistosomiasis may not be that great in those that will be slightly infected, then you may need another dose in such individuals. And you can give the double or the second dose 4 weeks after the first dose. Also, there are certain situations like refractory conditions with Schistosoma mansonae that you need to repeat dose, and in Schistosomiasis, in a woman of childbearing age with perineal bleeding, you may need more than a single dose. So it's not all that fixed as per the single dose, but majority will do well with 40 milligram per kilogram for Schistosoma hematobium, Mansonae, and intercalatum, 60 milligram per kilogram for Schistosoma japonicum and mekong. Now, the mechanism of action. Praziquantel will disrupt the tegment of the adult worms. Remember, as I said earlier, we use it to kill only adult worms, not the eggs. It will increase calcium permeability, and that will lead to accumulation of calcium in the cytosol. The presence of more calcium ion will then lead to an increase in contractions that will be followed by paralysis. Integumentary destruction will also lead to the induction of immune response in the host. There are two main factors that will determine how effective Praziquantel will be. Number one, the host immune defense system. And two, the parasite burden of infection. Administration. You can give Praziquantel with food. It has high bioavailability. It has a short half-life span and can only be given per hour. Combination. Praziquantel can be combined with 2 other drugs, giving us synergistic effects of the 2 medications. For example, you can combine Praziquantel with Oxamniquine or a derivative of artemisinin. So, number one, the 2 medications that you can combine with Praziquantel will be Oxamniquine or artemisinin derivative. But you can only combine one with Praziquantel at a time. So you can give Praziquantel with Oxamniquine, or you give Praziquantel with dihydroartemisinin piperacin. Now, the possible side effects. Majority will not even have any problem or any issue. About 30 to 40% will likely have mild side effects, and the side effects will include dizziness, headache, vomiting, diarrhea, abdominal pain, and pruritus. The above could be from Praziquantel or from the host response to the dying worm. So, those with high parasite burden will have more side effects. There may be paradoxical hypersensitivity reactions amongst travelers with acute infection or at the early part of the chronic infection. So it is a pretty, safe medication I will put, but then there could be idiosyncrasy where an individual will react in such a way that is not common to the general populace. Now, monitoring. You can follow up to know whether you are winning or not through the clinical signs and symptoms, serological investigation, or microscopy. Before closing this presentation, let me say that Schistosoma mansoni will appear to be a bit difficult to kill with Praziquantel than the rest. Might be due to high parasite burden or increased infection or combination of both. Then for the refractory Schistosoma mansoni, we can give Praziquantel more than once. We can combine Praziquantel with Oxamniquine, but Oxamniquine cannot be used in pregnancy. With that, I've come to the end of this very short presentation on Praziquantel, the drug of choice to deal with schistosomiasis. Thanks for listening. Please remember to subscribe to my channel. I appreciate it.